Native American Nurses Leading a Culture of Health conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a Q&A session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. If you would like to withdraw that question, simply press the pound or hashtag key. Thank you. Ms. Quinn, you may begin the conference.
Great. Thank you so much, Linda. And hello, everybody. Good afternoon and good morning, depending on where you are in our nation. So I'm delighted to welcome everybody to join us for today's webinar. This is a part of a series that we started last year where we feature members of the Campaign for Action's Diversity Steering Committee members and featuring the work that they do around nurses leading a culture of health. And today it's about Native American it's about Native American nurses and Native Alaskan nurses leading a culture of health. And we are doing that with our colleagues and friends from the National Alaskan Native American Nurses Association, also known as NANAINA. NANAINA is a very important member of our Diversity Steering Committee. It was founded in 1993 with the mission of uniting American Indian, Alaskan Native nurses, and others who care for American Indian and Alaskan Native people to improve the health and well-being of their communities. The webinar participants today will achieve the following objectives. You will learn about the history and current initiatives of NANAINA that are promoting a culture of health and well-being throughout Native communities. You will discuss a recent study focused on the Navajo school system and food environment that impact the nutritional needs of diverse children, including the potential policy implications of that program. And you will hear described an upcoming Native American nursing learning collaborative that we are launching this year. Before we go any further, I do want to mention that today's webinar is being recorded, so if you miss a section or would like to pass it on to a colleague, which we highly encourage you to do, you can find the recording by going to our website, which is www.campaignforaction.org/webinars. Also, for today's webinar, we will take questions over the phone at the end, but we also encourage people to ask questions via the chat function, and if you do so, please send your questions to everyone. And toward the end of the webinar, we're also going to have some polling questions and a couple of open-ended questions, and we will need you to provide the answers to the open-ended questions in the chat function. So what I am very happy to do right now is to turn this over to my friends and colleagues, Drs. Adriana Perez and Piri Ackerman-Barger, who are going to facilitate today's conversation with our other friends and colleagues. Thanks so much. Adriana and Piri?
Hi, this is Piri Ackerman-Barger, and I have the great pleasure of introducing one of our presenters today. Dr. Lisa Martin is president of the National Alaska Native American Indian Nurses Association, also called NANAINA. Dr. Martin is an assistant professor with St. Catherine's University in St. Paul, Minnesota, and a member of the Lac du Flambeau Band of Chippewa Indians in Wisconsin. Prior to working at the University of Minnesota, she worked as a public health nurse in inner city areas as a clinical educator, nursing supervisor, and project manager with several interdisciplinary public health programs. Her areas of interest include diabetes prevention in American Indian youth, holistic nursing, and integrative health care and cross-cultural competence. Dr. Martin has several years of experience teaching undergraduate and graduate nursing. In addition to her passion for teaching, she has experience building research partnerships with American Indian communities. Her ongoing research looks closely at American Indian youth living with overweight, obesity, diabetes, and hypertension, and it's an absolute pleasure to have her join us on this webinar today.
Thank you, Piri. It's a pleasure to be part of this webinar today. And this is Lisa, and I first want to say a heartfelt miigwech, which is thank you in the Ojibwe language. I am a member of the Ojibwe Nation from northern Wisconsin, as Piri included in her introduction. So I wanted to say thank you, miigwech, to our colleagues with the Robert Wood Johnson Foundation and the Association of Retired Persons, the AARP Foundation's Campaign for Action, for the support to include information about the NANAINA organization in today's webinar. So for the purpose of today's presentation, I'll be using a number of terms to describe American Indian peoples, and I wanted to point them out to the audience. Alaska Native, American Indian, Native American, and Indigenous. I'll be using those terms synonymously. I'm going to be starting out with some general background about Alaska Native and American Indian people. And wanting to let you know that there are many tribes in the U.S. Right now, approximately 566 tribes, each with their own languages and cultural practices. So there's great diversity within Alaska Native and American Indian people, and within the NANAINA organization, we try to reflect that diversity of the people that we work for. I'd also like to share with you that the proportion of Alaska Native and American Indian nurses to the larger nursing population is that our numbers are small, but we're very pleased that they're increasing slowly. There are now close to 36 nurse leaders with Alaska Native American Indian background with doctorates, which is an increase from about a dozen in the 1980s. So we're really happy to see this growth. So to start out, I'd like to share with you some history about the NANAINA organization. It has emerged from some important groundwork by American Indian organizations from the past. The first organization was the American Indian Nurses Association, AINA, which later was changed to be named the Alaska Native American Indian Nurses Association, AINNA. This organization did amazing work and disbanded in 1994 with over 2,000 members. Since that time, there have been smaller groups of American Indian nurses gathering around the U.S. to continue to promote and support Alaska Native and American Indian nurses, student nurses, and interdisciplinary health professionals working within American Indian communities. A focus of the work of American Indian nursing organizations, both past and present, has always been on leadership development, continuing education, and advocacy for improving health care that is culturally respectful for Alaska Native and American Indian consumers. So to the present time, approximately 10 years after the first American Indian nursing organization formed and disbanded, the present-day NANAINA was formed. In 1993, a group of American Indian nurse leaders representing tribal nations around the U.S. met in North Dakota, and their desire was to rekindle the spirit and reconnect the circle of Indigenous nursing that was a key part of the first efforts of American Indian nursing organizations. Now I'll talk about NANAINA, our vision, our mission, and our goals that structure the work that we do. The NANAINA vision is to exemplify excellence in nursing through outreach, self-determination, and research by using traditions and innovation to achieve health equity. So I'd like to just pull the term, the concept of self-determination from that vision and highlight it here. Self-determination is a concept of great importance to Native Americans in this country who want to see a healthy restoration within tribal communities, to renew our culture, and to develop reservations with equal input into decisions concerning policies and programs that affect us. NANAINA, the mission of NANAINA is to unite Alaska Native and American Indian nurses and those who care for Alaska Native and American Indian people to improve the health and well-being of all Alaska Native and American Indian peoples. And here in this photo, you see a picture of a drum, which is just a reflection of how we're all a member of the circle of life, and the drum signifies that. NANAINA values. We have three primary values: integrity, respect, and spirituality. The NANAINA organization will strive to make these values foremost in all that we do throughout the generations. The purposes of NANAINA, let me touch on those. We strive to represent all Alaska Native and American Indian nurses, as well as work to improve the healthcare services to Alaska Native and American Indian peoples. So we are an exempt 501c3 organization, and our unique purpose is in making charitable, religious, educational, and scientific contributions. Now let me share with you some of the work of NANAINA. Professional conferences. NANAINA has supported the Federal Indian Health Service funded, the IHS, nursing programs over the years through our conferences and by providing student scholarships. In this photo here is a photo from our 2017 NANAINA conference, the first conference after several years, which we were proud to hold in St. Paul, Minnesota. Here is a picture of myself, our past president, Misky Wilkie, and our colleagues with the Robert Wood Johnson AARP foundations. At the first conference in many years last year, we decided to move forward with a theme to rekindle the spirit of Indigenous nursing and to reconnect the circle of Native nurses. We also recognized and honored the memory and work of Dr. Roxanne Struthers, a NANAINA past president, who was a vibrant trailblazer for American Indian nursing. In the early 90s, Dr. Struthers revitalized and led substantial growth in NANAINA as an organization in membership and was a thought leader on cultural competency and increasing awareness of health equity within American Indian communities. As we look ahead, we'll be holding our next conference this year in 2018 on June 8th and 9th. And the theme for this conference is a vision for Indigenous nursing. Now that we've begun to reconnect the circle of Indigenous nursing, we need to reconsider our vision and where we want our future to be. At the end of this conference, we're hoping to inspire the participants that attend to have to know that vision and be empowered with creative, successful, and unique examples to recruit and retain American Indian nursing students, and helping us move closer to attaining the NANAINA vision, mission, and values to greater health in American Indians in the U.S. Registration information for this conference will be in this webinar, and I hope you will consider joining us at the 2018 conference. The current work of NANAINA also includes our website. Here is a picture of our current website, and we are in the process of developing it. And I invite you to visit this website to learn more about what we do and our outstanding board members who are a part of the present NANAINA organization. As a growing nursing organization, we are building knowledge and capacity as a board to help move closer to our goals with the help and commitment from these amazing American Indian nurse leaders. Each board member contributes substantially to our future, and we meet annually, especially to revisit our strategic plan and goals. In closing my part of the webinar today, I would like to highlight just a couple of the efforts of our nurse leaders on the board and within the organization who contribute, and they are Dr. Tom Orme and Dr. Wilkie. Lillian Tom Orme has been a long-term member of NANAINA and currently is providing a unique effort on behalf of NANAINA to outreach to tribal colleges around the U.S. to identify best practices to connect and support American Indian nursing graduates from these institutions. We're trying to learn how NANAINA can support these individuals with the things that they need as they graduate. Dr. Tom Orme is also currently writing a white paper on Alaska Native American Indian elder health along with Georgetown University. A member of our board also I would like to highlight at this webinar is Dr. Misky Wilkie, who is the director of the Minnesota Bemidji State University's Nagana Winnie Mananeg program, named for an Ojibwe word meaning we take care of them. So with the goal of supporting efforts to recruit, retain, and graduate nurses from underrepresented and disadvantaged backgrounds, this program receives nursing scholarships up to $4,000 and monthly with stipends up to $500 for meeting specific program requirements. Nursing students attend weekly meetings and goal-setting sessions with a faculty mentor and participate in scheduled activities and attend assigned tutoring or study sessions. The program is highly committed to its students to help them achieve and progress to their goals in graduating. In closing, I would like to invite you to, again, visit the NANAINA website. A link is provided on the slide here. And please consider joining us at the 2018 NANAINA Conference on June 8th and 9th in St. Paul, Minnesota. More information on registration will be posted on the NANAINA website soon. It's been a pleasure to be with you today. If you have any questions, please feel free to contact me at the email address listed on this screen. And miigwech, have a good day.
Next slide. Thank you, Dr. Martin. This is Adriana. Your leadership and your work with NANAINA is so important, and I look forward to our discussion shortly, especially in how action coalitions can reach out and your recommendations for working together on addressing and advancing your mission. At this time, it is my pleasure and honor to introduce Dr. Regina Eddie. She is going to be presenting on her work focused on childhood obesity and school food environment in select schools on the Navajo Reservation. I'm excited because Dr. Eddie is a fellow Arizonan and educator. She is an assistant clinical professor at Northern Arizona University School of Nursing and also a Robert Wood Johnson Foundation Nursing and Health Policy Collaborative Fellow and a new diversity consultant with our team at the Center to Champion Nursing in America. So you will be hearing a lot more from her. Her program of research is focused on using a socio-ecological framework and Navajo cultural framework to evaluate school food policies and practices. Dr. Eddie's dissertation study highlighted the importance of policy and school engagement for promoting health in children and assisting in prevention of childhood obesity in the Navajo Nation. As an enrolled member of the Navajo Nation rooted in culture and tradition and experience, as a public health nurse and program director serving in Navajo communities, Regina possesses an in-depth knowledge and understanding of the many health issues and strengths affecting that are part of the underserved population in reservation communities. She has worked with the policy and delivery of health care for a newly tribal self-governed health care facility under the Indian Self-Determination and Education Assistance Act. Dr. Eddie received her PhD just recently, so congratulations. She defended her dissertation last month at the University of New Mexico. She also received her MSN and BSN from Northern Arizona University. So with that, I'd like to welcome and turn this presentation over to Dr. Regina Eddie.
Thank you for the introduction, Adriana. Good afternoon, everyone. So just kind of a brief introduction. So again, my name is Regina Eddie, and I'm originally here from Arizona. I'm a member of the Diné Nation or Navajo Nation, and in our language, saying greetings, yat-e, to all of you this afternoon. So as was mentioned in my introduction, I will be presenting an overview of my dissertation project that was conducted on the Navajo Nation that examined school food environment and practices in select schools. I think this study demonstrates an example of culture of health work at the local grassroots level that aim to create healthier, more equitable communities. Here's a map of the Navajo Nation. The Navajo people occupy the largest American Indian reservation in the U.S. That extends into the 3 states of Arizona, New Mexico, and Utah. And the Navajo Nation is the second largest American Indian tribe, with the last 2010 U.S. Census data that recorded over 332,000 tribal members. The circles on the map are the 4 communities in which my schools were located in. So these are the sites in which I travel to conduct my dissertation project. Just a brief comment in terms of in giving you a little bit context. The distance to travel between these communities, I think on average, were about 50 to 90 miles apart from some of these communities. The purpose of my study, important to the study, was to examine how schools that participated in the National School Lunch Program were implementing nutrition policy and standards that were prescribed by the Healthy Hunger Free Kids Act, and essentially to see how this contributes to the diets of Navajo children in schools. Next slide. So a little bit back, my research questions. So these are the 3 research questions. So again, looking what are the current nutrition policies and practices, looking in elementary and middle schools, what are barriers and facilitators that schools experience with the implementation of these latest standards and policies. And lastly, how are schools integrating and or promoting Navajo cultural beliefs and practices in school health policies and programs. So with obesity rates in American Indian children that far exceed U.S. rates, and then with no prevention strategies that have positively impacted obesity rates, this study focused a lot on the school environment. On a national scale, studies that examine the school food environment have found that schools have not always provided a healthy food environment for children. So interestingly, there is no published research that has specifically examined only schools in American Indian communities. So it's also important to explain here that the Healthy Hunger Free Kids Act is a federal nutrition legislation that authorized comprehensive changes for school meal programs, including the National School Lunch Program.
Regina?
National School Lunch. Yeah.
If I could very briefly interrupt, I don't know if this is happening for other people, but your connectivity is a little shaky right now, so I'm wondering if you could maybe adjust your headset or move a little. That might help.
Okay. Is that better?
A little bit. Maybe speak up and that should take care of it.
Okay. The National school lunch program is funded by the U.S. Department of Agriculture and is administered by state agencies and local school food authorities. So some of the changes that school meal programs were required to implement was to offer more fruits and vegetables, whole grains, fat-free milk, and then reducing the sodium content of meals. I hope that's better. Go to the next slide. So as a Navajo nurse researcher, it was important to approach this study to not only using a Western framework, but also from a Navajo cultural perspective, and with this using the Navajo concept of hojo. And integral to both of these frameworks, both center on the importance of relationships, and specifically the relationships among people, their environment, and health. So essentially, I saw that these frameworks aligned with one another. So the Navajo concept of hojo, I think it's important to also note here, in describing this concept, there is no accurate description in the English language that adequately translates the meaning of this concept. But yet it is generally translated as harmony, balance, and all other positive characteristics and forces. So essentially, for the goal of Navajo people is to achieve and maintain hojo. So basically achieving balance and harmony. And this was important, has important implications for the health of Navajo children. Next slide. Okay. So Navajo elders today attribute the health concerns that youth are experiencing is a direct result of deviating from the teachings of hojo. So essentially, many youth today, I think there's concern about the loss of cultural identity, language, and then lack of discipline, and just really the type of lifestyle. I mean, youth today are a lot more sedentary than how our ancestors at one time practiced on a day-to-day life. So this is just kind of a slide explaining kind of the views from the Navajo elder perspective on how they saw, you know, the views of child health today. Next slide. So this is the socio-ecological model and illustration of it, and with each of the circles that represent the multiple influences on student health and nutrition. So starting with the outermost circle representing federal policy, the Healthy Hunger Free Kids Act that I mentioned earlier, that funnels all the way down to impacting the student interpersonal. So the red circle represents the children, and these are all the different influences. Next slide. So for my dissertation project, the type of research design that I employed was a descriptive research design in which I used both a survey and then observations, being on site at schools, and then the surveys also included open-ended questions. So there were questions that were asked to the participants about the school food environment. And for this type of research design, the goal, I mean, for me was to gain really a baseline picture of what was happening in the school environment. So in this study, you know, I did not, my goal was not to, I guess, implement an intervention. It was really just to learn about what was going on in the schools. Next slide. So for this study, my study sample included 6 schools on the Navajo Reservation, and the schools that participated were elementary and middle schools that were participants in the National School Lunch Program. And within these schools, it was the principals and food service workers from each of these schools that completed a 2-part survey. And then, as I mentioned, observations were also conducted in 2 schools. So total participants were 20 participants. Next slide. Just real briefly, just to kind of mention in terms of the analysis, so because there were multiple sources of information that was gathered that required the same approach for analyzing my data. So for the results, again, because I employed 2 surveys, let's see, did you go back on that, Christine? So the first set of results were the principals. So the principals were asked questions about what policies were in place, what practices were in place. So just kind of to highlight a couple of findings from here, it's interesting that most principals were familiar with the school health-related policies, but weren't necessarily familiar with the nutrition requirements related to their school meal program. And then a lot of the schools did not have an active advisory or wellness council. And then food-related practices. It was also interesting. Can you go back, Christine? Okay, so for food-related practices, some teachers are using rewards like candy, snacks, as part of their teaching, whether it's lessons, parties. And another interesting finding was a lot of the principals, in terms of like health screenings, that was very limited for, a lot of these schools, they don't have school nurses. So having the resources to come in and do body mass index screenings. So that was a concern there. Next slide. So in terms of the food service workers, none of the schools had a registered dietitian employed for their school meal programs. And then in looking, I'm just going to kind of skip down to the National School Lunch Program characteristics. So as I mentioned, a lot of the standards that were required, schools are supposed to be offering more healthier versions of milk, even more fruits and vegetables. So there was kind of a mixed response where some schools were still offering the unhealthy version, the whole or 2% milk, and some schools were still as well as offering fat-free milk, for example. And then in terms of the school lunch program, schools were also offering what they call a la carte foods. So these are other foods such as like your pizza, French fries, tater tots. So interestingly, as long as these foods were available, kids were opting these foods over the healthier foods. Next slide. And here's just what I was getting at here was kind of what the experience has been with implementation of the nutrition standards. There was some responses where food service workers felt like they did not have the support from their administrators from at the district level. I think they felt there was more criticism in a way in terms of having to prepare, the healthier meals. And then lack of familiarity with nutrition standards, so a lot of the food service workers were not necessarily familiar with the new nutrition requirements. And then in terms of integration of Navajo traditional foods and other Navajo cultural practices, a lot of the schools were contracted with a food service company. So it was interesting to learn that a lot of these companies restricted the schools from serving traditional foods as part of the National School Lunch Program. And then in terms of what was going on in the classroom, some classrooms were offering, like inviting grandparents into the classroom to provide cultural teachings and then even food demonstrations. So again, those were just some examples of what was going on in the classroom. Strengths and limitations of study, I think I'll just kind of breeze over this, but essentially this was a study that was first of its kind, really looking at kids or school nutrition programs on an American Indian reservation. Limitations, it definitely was a smaller sample size, but again, my goal was not to generalize here. So I'll just mention that for the slide. Next slide. So for my summary, conclusions, and recommendations, so again, how approaching it from a socio-ecological model. So there were definitely implications, for example, at the community level. There's a need for, I guess, more school board involvement. I think there's opportunity there for policy development, opportunities for schools to enhance their school environments. One example is getting more schools to apply for funding that support farm-to-school programs and even school gardens. And then at the school organization level, I have just kind of breeze over this as well, but again, I think there's a lot of opportunity here for policy development that would support and promote healthy school food environment. And one example is possibly engaging students in taste testing demonstrations, getting their input in what foods and snacks that they would enjoy, that they would eat. Next slide. And then at the interpersonal level, so again, this is, I think there's opportunity again to further expand and involve elders, Navajo elders, grandparents in a school environment, even the role of food service staff to be, because they're the ones, they're frontline workers. They have to interact with children as kids are coming through the cafeteria lines. And then, again, down to children, I think ways to find ways, strategies that Navajo children will, restore, relearn a lot of cultural practices, cultural identity. So I think there's definitely support and a movement on Navajo Nation to do that in the schools as well. So recommendations for future work. I think what I want to highlight here in my role as a Navajo nurse researcher, I think it clearly aligns with the work as a new diversity consultant, so continuing to build on relationship established with the Navajo Nation. And I think you can go on to the next slide, Christine. Thanks. So recommendations for Action Coalition. I think key here, what I want to emphasize is reaching out to nurse leaders and tribal communities, inviting them to join Action Coalitions. And I think important here would be a need to be flexible in doing so, because I think what has to be considered are challenges with remote communication A lot in these remote communities, there may not necessarily be maybe good internet connection. So I think maybe arranging these meetings that would accommodate, I guess, taking these into consideration, working with nurses from tribal communities. And then again, working together with Native American nurses to highlight regional culture of health topics focused on tribal communities. So this can be done through organizing and planning conferences, summits, maybe partnering annual presentations or publications. And with respect to the study and its finding, it definitely presents opportunities for further policy development with the Navajo Nation, including schools and school boards, and even at the tribal level. So I think, again, just as I mentioned earlier, I think a lot of this work really aligns and features culture of health work in ways to improving the health of an underserved population. Next slide. Questions? You want to go to the next slide, Christine? So as was introduced by Wynn earlier, we are happy to announce the initiation of the Native American Nursing Collaborative. So as part of this collaborative, there is much work that needs to be done. So we will be launching a series of webinars and teleconferences that is open to all. We welcome your participation and input. So these are some of the proposed webinar schedules, understanding the health of Native communities, social determinants of education, and highlighting health through research, work, and community engagement. So further information will be forthcoming about these upcoming webinars. Next slide. So in ending, we have several polling discussion questions. Is your action coalition engaged with tribal communities? Would you like help connecting with Native American tribal communities? And what would you like to accomplish in your work with engaging Native American tribal communities?
So, Christine, these questions here, these are the yes and no questions, right? The first two questions are yes and no. Were you able to put this in where people could respond in a survey, or do they have to reply in the chat function? Christine?
Hi, Wynn. Yes, so I'm going to attempt to do the polling question now for the first one, and then if they're able to respond, I will collect that polling question. So I'm going to go ahead and put that in now.
Great.
Okay. And it'll just take new. It's going to take, so I'm going to type that in now and then share the polling question. And then if all that are able to respond, if they could respond. So the first one is your action coalition engaged with a tribal community? Great, I'm going to open the poll. Okay, I did open the poll where it looks like it. Okay, we'll get a few seconds. We do have. Okay. Great, and we're going to close the poll. Okay, and we had 5 responses. Oh.
Christine,
All right, yes.
When you showed the poll, it didn't
yes.
show the results. It showed that there were no responses in each, but if you saw that 5 people replied, what were those responses?
Yeah, I'm looking to pull it up now, and I may not have. So actually, if we could, it looks like this polling, it's not working the way it should be. So can we ask those to respond? It wasn't that many in the chat function.
Okay. So how about if we ask folks, if you could open up the chat dialog box, and answer your questions there, answer our questions there. So first, we would like to know if your Action Coalition, and there might be people on this line that are not even associated with an Action Coalition, is your Action Coalition engaged with the tribal community? If not, would you like help connecting with Native American tribal communities? And what would you like to accomplish in your work with engaging with the Native American tribal communities? So if people could just add their thoughts to those questions and include them in the chat box, and please be sure to include your to answer to everyone, not just the host. People are also welcome, Linda, the operator, if you could ask people if they would like to join, answer these questions, or if they have any questions themselves.
Okay, you ready for the Q&A session?
Sure. Why don't we open it up?
At this time, I would like to remind everyone to ask a question, press star, then the number 1 on your telephone keypad.
As our attendees are thinking of questions, comments, I would like to pose a question to Dr. Lisa Martin in regards to, action coalitions reaching out to the Native American and to NANAINA in their local states. What do you recommend in terms of outreach? When we talked a while back, and you had some really great recommendations for nurses and the action coalitions.
Thank you for your question. This is a very important question. How do we begin a relationship with a tribal community? And the action coalitions are really wanting to engage with tribal communities to design their efforts to have maximum effectiveness. I think the first thing to consider is that in working together, we may come from different perspectives, perhaps as academic individuals, people who are highly trained in the scientific methods, or more linear type of thinking in tribal communities, in programs that work in depth with American Indian populations. There's a greater presence of circular kinds of thinking. So as in Dr. Eddie's slides, as she mentioned many times how we work together, that becomes clear right away that we may think differently about how to approach issues and just the basic processes of teamwork and working together. So allowing time to develop a relationship is very important. These type of partnerships may have an extended relationship period, building period, before we move into decision-making and the designing of the work we're doing together and the goals and so forth. So that all could take place much differently. So that comes to mind in as you asked the question. Another thing I would recommend is working to identify new creative approaches to removing barriers that have been in place, financial, for example, that allow communities to participate. There may be some barriers we need to address before we can really connect with tribal members to learn their perspective, to be inclusive, and to promote that self-determination I was talking about earlier.
Very helpful, very helpful. Thank you so much. And I know we have 2 questions in the chat box, and or several questions and comments. The first one from Whitney Fear. She is interested in connecting with Native American tribal communities. She comments that she would like to see more diversity in the North Dakota Action Coalition, currently only Native American. She's the only Native American on her action coalition. There's rarely representation of diverse nurses in state functions. I think that, gets at, Lisa, what you were mentioning, and how can action coalitions do outreach to Native American nurses for their action coalitions and issues to consider. Is there anything else that you want that the group has to share with Whitney? Whitney, also the other thing that we can do is all of the diversity consultants are assigned to states. So in our quarterly follow-up, that is something I think that our team can also follow up with all of the action coalitions as we check in to work or look at the progress, how we can be of assistance. I think that's something that we can follow up with as well. Jody Harris has a question, comment. She works for a tribe and participates in an action coalition that is countywide. The main focus is preventing substance abuse with our youth. And she shares that there are 2 Native American tribes in the county, which is very helpful. Let's see. One of the comments that Regina brought up was outlining a schedule of webinars for 2018, and this might be, Regina, a good topic to focus on. Jody, we would love to reach out to you and learn more about the work you're doing. And Regina, Lisa, Piri, I don't know if you have any comments for either Jody or Whitney as well.
This is Winifred. I actually have a question for each of them.
Okay.
I just wanted to know which state they were each in.
Okay, looks like Whitney Fear is with North Dakota.
Right, right.
And Jody Harris.
Wisconsin.
Jody, can you include that in the chat box?
Yeah, Wisconsin, and then Charlotte.
Yes, Charlotte says she is interested in a better understanding of tribal communities, culturally relevant information, and cultural awareness. She's a white RN. She says not a tribal member. Okay,
both are in Wisconsin. So I do want to point out, this is Winifred, I do want to point out that apparently the Robert Wood Johnson Foundation is quite interested right now in engaging on health issues related to Native Americans, and the states of Wisconsin and North Dakota, South Dakota, and several other states are also in their range of interest. So, Whitney, you might want to bring that information back to Patricia Moulton, and perhaps, I know that she's pretty effective at writing grants, so maybe you could help write a grant that would be focused on addressing the health and well-being of tribes in North Dakota that would engage tribal people, including nursing. Tribal leaders included nurses, and then the same goes for the folks from Wisconsin. I know Barbara Nichols is not available currently, but perhaps the two of you might want to connect and see what funding opportunities are on RWJF's website. And also keep in mind, please let those of us here know if you're interested in getting help from us at the Center to Champion Nursing in America. Any one of you and anyone on the phone who's interested in doing so, please contact us. You have Regina's contact information is about to be posted, and Lisa Martin, who is with the NANAINA, her information was posted. But you're also welcome to, my email address is on the website. Christine's is. You could find us very easily. We'd be happy to help you.
Thank you, Wynn.
This is Piri, and Whitney, thank you for your question and comments. And one of the things that I wanted to say is that with the launching of the Native American Nursing Learning Collaboration, our goal is really to, over the next year through webinars, highlight things that people are doing in different communities. And, I think that there are a lot of really brilliant efforts that are happening around Native American health. And I think that by sharing those and highlighting outcomes and the different approaches, that we as a nursing community can come together to make changes and to promote healthcare. I mean, the Nursing Learning Collaborative, the Native American Nursing Collaborative, is hoping to serve as a conduit for promising practices and really highlighting some of the positive efforts that are happening around the country, including in your neck of the woods, Whitney.
Kristen, thank you both. There are 2 more slides. Christine, if you want to help us so that I know we're at 2 minutes over so we can close our webinar.
Hi, this is Linda, the operator again. Also, there no questions popped into queue. Just wanted to give you that update.